Federal prosecutors proved that Ruthia Hay, the CEO of Doane Global, and David Brody, the company's clinical president, ran a subscription based Adderall operation that generated more than $100 million in revenue. A federal jury in San Francisco found both of them guilty on November 19th. They now face a maximum of 20 years in prison. So the evidence showed that Doane Global used a nationwide ad campaign on social media during the pandemic to push the idea that millions of people had undiagnosed ADHD. The company spent more than $40 million on targeted ads to funnel people into fast online evaluations. Prosecutors said the goal was to get as many stimulant prescriptions out the door as possible. More than 40 million pills of Adderall and similar stimulants were distributed through Doane's system. Many patients were renewed month after month with little or no medical oversight. The DOJ presented records showing that patients who reported severe side effects, bipolar disorder, Adderall-induced psychosis, or substance misuse were kept on stimulants anyway. Families contacted the company, repeatedly begging them to stop the prescriptions, and were ignored. Prosecutors said that Hay encouraged employees to view addiction as a business model and rewarded staff for pushing high volumes. Brody allegedly instructed nurses and prescribers to continue approving stimulants even when patients showed red flags or when it could put them in legal jeopardy. The company grew rapidly by avoiding clinical standards and profiting from controlled substances. Federal authorities call this one of the most extreme abuses of telehealth ever seen. This is the first time leaders of a digital health company have been criminally convicted for illegal distribution of controlled substances through online prescribing. Sentencing is set for February 25th. This case is a warning for anyone working in telehealth. If a business model depends on shortcuts, volume, and controlled substances, federal agencies will treat it the same as any street-level drug operation.